This is our 1563rd day of continuous webinar. Thank you all the participants for joining with us. And before beginning the session, we will have a silent prayer. Okay, thank you, sir. Thank you. And today's our guest is Dr. Mukesh Hemraj Parewal. He is MD and Associate Professor in the Department of Physiology and Biochemistry, KB Abad Medical College, Aurangabad. He has 22 years of teaching experience and 22 years of clinical experience. He had done many researches. He has knowledge and skill in various field of study, research. He is an examiner, coordinator, IQAC coordinator, researcher, and in many areas he has experience. Thank you so much, sir, for coming and sharing knowledge with us. And you are welcome to our IFPH Zoom platform. Thank you, sir. You're welcome.
Madam, thank you. Am I audible, madam?
Yes, sir. Yes.
Okay, thank you very much. So let us begin our session, Understanding of Sulfur through Rubrics. Last time I have conducted a session, Skin is a Mirror of Mind, and I have gone through different cases. Today's session is Understanding of Sulfur through Rubrics. So any one of you can have any idea about this picture? Anyone? I'll just show it again.
Sir, are you moving the slides? Now also we can see the first slide, Understanding of Sulfur through Rubrics.
Okay.
You're trying to put the second one?
I'm trying to put second. Now it is visible second?
No, sir. Still first.
It is first only.
Yeah.
Now? No?
No, sir, no. Have you yeah.
Now it's visible.
Yes, the second one.
Okay. So anyone want to comment on this? Because as today's topic is understanding of sulfur through rubrics, not through merely cases. Anyone wants to have a try? So if you see this picture, is the first rubric through which we can understand sulfur is person is absorbed in thoughts. So if you observe this, first and very important rubric through which we can understand the sulfur, that is, he is absorbed in the thoughts, where he is thinking and thinking. So just by seeing such type of patient's look or face, you can have idea that absorbed in thought is the first rubric. Slide is moving. Second picture you are seeing?
Yes.
Okay,
now it is third.
Now it's going on there. Now see, again I'll go back. This is absorbed in thought.
Yeah.
This is second rubric through which we can understand sulfur is
aggressive.
Yeah. Anyone wants to try again? This is irritability, that is angry easily. This may not be irritability. This is irritability where person is angry very easily. Whatever rubrics I have incorporated today for the today's lecture are from synthesis, from Kent repertory, from complete repertory, and those rubrics I have taken, those which I have seen in my clinic on the patient. As well as I have tried to taken the rubrics which are 3 marks, either in the synthesis, either in the Kent, or either in the complete repertory. So highly marked rubrics I have taken. So second rubric is irritability, angry very easily. Especially sulfur patient is angry at the 11 a.m. Usually in all the repertory they have given patient angry very easily, but especially at the 11 a.m. This is third rubric. Anyone wants to share? Anyone wants to comment?
Depressed. Tired?
No, no, madam. See, lecture should be two-way. Anyone wants to try it? Because see, patient will not come to you. Patient will come in all these forms only. Yes or no? Like this picture. Patient in front of you will be like this. He will not say that I'm absorbed in thought. You have to
Yeah.
observe. You have to observe the patient. That's why I'm showing these pictures. He will not say by his that doctor, I'm absorbing thoughts. During case taking, with his gestures, with his attitude, physician or doctor has to identify and then match the medicine. This is third slide. It is visible, madam. Third slide.
Yes, yes, visible. And we got some comments like anxiety, anguish,
Yeah.
like
Correct. Thanks for reading those comments, madam. Actually, it is anxiety, pressure on chest. Very clear. Just by seeing a picture, it is anxiety, pressure on chest. This. Because see, again, patient when enter your clinic, you have to observe such type of patients, such type of gesture, such type of attitudes of the patient. Again, he will not say. This is
we have comments like disgust, uh, rude, morose.
okay. Such type of faces we observe usually person who are very critical, who are very censorious. What is censorious? You know, there is one censor board who is observing the entire movie and they are censoring few portion of the movie which they feel it is not good. So such faces, if you observe, those people are censorious. You know, if doctor asks some questions to that patient, he will make face like this. What the doctor is asking? This is censored question. So the face is censorious, very critical. So censorious, critical. This is very easy. Madam, kindly read comment for me if it is there.
Sure, sir, sure. Fault find, sorry, that is a, no
That was
comments for
last.
this speaker.
Yeah.
Yeah.
Anyone? This is very beautiful rubric of sulfur, which we have learned from our teachers.
Surely. Ragged.
Yeah, very good, madam. It's a it's a
No, actually,
delusion. It's a
the comment I've
delusion.
written.
Beautiful rat seems beautiful. It's a delusion. Rat seems beautiful. You know, if you see the beggar who is wearing a rug, but he feels that it is very beautiful. A girl which I have shown here, she have wear the very, the dresses which may not having any sense, but she is feeling, you can see that sense of feeling beautiful, that she is so beautiful, but she have wear the black kurta and that cap, which is very, color is so vibrant and color is very mismatched, but still the happiness of the face you see, she feels that she looks very beautiful. So this type of delusion Rex seems beautiful. This is the understanding of sulfur through the rubric. Go to the next. I think next slide is moving. You
Yeah,
can see
moving. Yeah.
anyone? Anyone?
No comments.
No comments. It's very easy again. Again, this is very beautiful rubric which we have studied in
Delusion.
repertory.
Ugly looking, delusion, delusion.
It's again delusion. It's again delusion. See, there we must understand what is delusion. What is elements from. Elements from is that when actually person is suffering from that complaints, and delusion that he feels that he is suffering from that complaints. Like if suppose there is one daughter-in-law and she is having any trouble in the family and she get ill. If there is actual trouble from the family, you can say those are the elements from, or she is wrong suffer she is. But there is no trouble, but her mindset is that she is feeling that she is getting trouble. That is delusion. Delusion wrong suffered she is. Actually, this is not that rubric. We'll again come to the rubric and picture. This is any comment, madam? Any comment from anyone?
Yeah, delusions are there. Ugly look.
Okay.
Getting thin.
No, no, it's actually delusion thin she is getting. Delusion thin she is getting. Okay.
This also
So
there in our
actually she is very
Dr.
fat.
Raj has
Actually she is very fat, but she feels she is getting emaciated or getting thin. Next. This is again very easy rubric, which is very common in the sulfur. Whatever rubrics I am showing here, I have used actually in my clinic, and those are proved even in repertory it has been given. And I have just by taking the 2 or 3 symptoms, I have chosen the sulfur and give the sulfur, and patient got the result, irrespective of any disease, right from cold coryza to the dengue and so on, just by with the help of these rubrics of sulfur. This is
on
again
physical
delusion.
fear of injury.
Yeah, it's actually delusion. Injury is being injured. This is again, she is having a delusion that she is being injured by someone. No,
Yeah.
somebody will injure her. This one. Very common rubric in the sulfur. See, usually what we see in the sulfur burning and all those very common what we have learned in our college time. But if you go with these all rubrics which has been given in the repertory, it become easy to understand sulfur and it become easy to identify sulfur patient in our clinic. Because patient will
Disgust,
not come back. Yes.
disgust, evading look, disgust feeling.
It is disgust feeling. Very good. It's a disgust feeling. So when such type of and literally we see in the clinic that if we ask someone regarding something, patient will make the face like this. So this is disgust feeling. Disgust. This is
Sleep with half closed eyes.
when this will such thing will occur that sleep with the half
Or
closed eyes. What we call it again, thoda or deep में.
faint spell
No,
from
no,
Dr.
no.
Afsar.
Comment, madam,
Morose.
any comment?
Yeah, I'm reading the comment.
Okay,
Sleep with
okay.
half eye open, faint spell, morose.
Okay. It's very
Bored.
simple. It's very simple again, which we will see, which see in the sulfur, and this is simple dullness. Usually such type of dullness we observe when children's or any patient is in a fever. When they are in fever, such type of dullness we observe. So simple, this dullness is seen in sulfur. And there is one stage, that picture is not with me, when there is extreme fever and one step patient go ahead than the dullness, that is what we call as a torpor. Torpor is another rubric. So torpor is also there, but this is dullness. This is dullness. This is not torpor. Torpor where complete eyes closed and he will sit like this in front of you on the table. He is unable to move his head. That is torpor. This is simple dullness. This This is again very beautiful rubric. Almost, if I have seen 50 cases of sulfur, I have used this rubric in almost 30 cases of sulfur. And this is very, very easy. Patient will, when patient is sitting in front of you, he will give all this type of look. He will not say that I am having burning, I am wearing crown, that my rugs is feels very beautiful. He will not say all these things, which we have seen in the Allen's keynote or some any other book, Boring and all those. Comment, madam, any comment?
No, not yet started.
Yes,
Come on.
yes, they can take their
Awkward
time.
and, awkward and shyness.
Awkward and shyness. Okay, very near. This is again very common in sulfur. As I told you, out of 50 cases, 30 cases, I have observed this rubric and I have given sulfur and patient got cured.
Or you can say that is better.
Okay,
Otherwise,
okay. No issue, madam. It's again very simple rubric. It's embraced elements after. This is kind of embarrassment. This is kind of embarrassment. So such type of faces, you see, this person is having that typical embarrassment. Embarrassed after elements. See, the person will make face like this. One side lip, he will turn to one side. You can see it in picture. He will turn his lip to one side. If you ask any question, if you ask what do you feel about your disease, he will make face like this. One lip will go to one side. If you ask some questions to him, he will put like this. What doctor is asking? So it's embarrassment. This is embarrassed. Usually we see all this in clinic, but we neglect those symptoms and it is seen in sulfur. It is sulfur. That may be in any other remedy also, but very marked remark in sulfur. This one.
angry.
No, it's not angry. It's fear of insanity. The patient will feel that he will become insane because of complaint or whatever. Such type of feeling will be there inside the patient. That is sulfur. So fear insanity of. This is again very beautiful rubric. This lady is observing the person who is, in front of her. Any comment? We will wait for a few seconds for comment and then we'll go ahead.
No, antics and antics.
Okay. No, this is see, foolish behavior, happiness and pride. This is foolishly pride. This is foolishly pride. That lady is observing what this man is doing foolishly in front of her. This is foolishly behavior. So usually when patient come to your clinic, in front of physician or doctor, he will behave very foolishly. This is, but he is behaving foolishly, but he is doing that gestures with very pride that I am doing very correct and very right and I am absolutely right. These feelings are there in the what we call as a sulfur. That's why sulfur feel that I am a king, where actually he is not so. So this is foolish behavior, foolishly behavior, happiness and pride, or foolishly pride. He feels that whatever I am doing, that it is of my pride. So that is sulfur. This is again
Shy,
such type of,
timid.
yes, it's a timidity. Again, such type of behavior, when patient will come to us, he will behave in this way. Rather, we have to observe that gesture. If we ask something, he or she will do like this. So it is timidity. So of course it is timidity. It is not necessary that timidity we observe only in calcaria. It is even in sulfur, and it is given for 2 marks. Another rubrics, now this are beside the pictures, hope all the pictures are clear to you, where we have seen sulfur is absorbed in thought, irritability, anxiety, pressure on chest, censorious, critical, delusion, beautiful rack seems, delusion, emaciated, delusion, injured, being injury, delusion, disgust, dullness, embarrassed, ailments after, fear, insanity of, foolish behavior, foolishly pride. These were all the rubrics which I have tried to show with the help of pictures, and usually we see such type of attitude and gestures when patient come to our clinic. Now, few more rubrics of sulfur. Delusion great person is that whatever uh, whatever he is telling, he will feel that he is very great. So delusion great person is, when patient come to your clinic, he will sit in the chair and he will do like this. He will rest on the chair in front of you, and one hand is on the that cushion of the chair, and he feel that he is very great, and then with that greatness he is communicating with you. So this is the delusion great person is. Actually he is not so. Actually he is not so, but he feel he is very great. So with the very great words, he will communicate with you. Sulfur, sulfur, he feel that he is very great. Anxiety, hypochondriacal, and usually sulfur patients may not be the doctor, but just by reading from here and there from some medical books, he will try to prescribe the medicines. He will suggest the patient that you take this paracetamol, you take, even he suggests the Ayurvedic and homeopathic medicine, that you take this medicine, that medicine. This is what we call as anxiety hypochondriacal. They will read the books, mania to read medical books. These people are not doctor, but gives medicine to people. Such people are sulfur people. They will come to your clinic and they will tell you, doctor, I know this medicine. I have prescribed that medicine to one of my friend and he got the good result. But I don't have a result from this medicine. So he will tell you like this. So this is read books mania to read medical books. This is a rubric. This is a rubric given in complete repertory, that read books mania to read medical books. And as I told you, he feels that he is very great. So, and as we have studied the foolishly pride also, so with very, actually it is foolishness. He is not doctor, still he is prescribing, still he is giving medicine, and he feel that he is very great. So he will sit like this and he will tell you that, doctor, I am prescribing, I am doing like this, I am doing this. This is all, this is sulfur. You have to identify this is sulfur. This is, you can see, ambitious. Ambition increase, money to make money. He feel that he can grab the sun, moon, and everything. So that's why it is a ragged philosopher. That's why he's a ragged philosopher. So ambition increase, money to make money. He is very ambitious. He wants to make money from this or that way. So this is sulfur. And thus that all will be revealed from his talk. That all will be revealed from his talk. This is again very important and very useful rubric, user error. Anyone have any idea regarding this rubric? I have used this rubric in my clinic very oftenly.
No, sir. No idea.
Anyone having any idea about this rubric? I think many of the rubrics are new to people or what? But it's all given in Kent repertory, and repertory is, any idea? User error. See, there is when we take any we purchase a fridge, TV or something like that. There is user manual. There is user manual. What we do with the user manual? With the user manual, we read the everything and then we operate the things. From that, this word has become userer. Madam, any comment for userer?
No comments.
Okay. Okay. Userer, patient will come to your clinic. He will tell you his or her own complaints. We prescribed him or her. We give medicine to that patient. Then silently he will tell to you, doctor, my daughter is also suffering from cold and coryza. Can you please give me one dose for her also? This is userer. So they will try to, grab the things from you without giving any money, because when another patient will come, you will charge extra to that patient, number one, or you will ask that she don't have any appointment. So on one appointment, she will show the two patient or he will show the two patient. This is usurer. She will come for her, but she will tell you that my daughter is also suffering from so and so. Kindly give one dose. With your one dose, she will be all right. That patient will tell to you like this. This is user rubric. Next, we will go to next. See again, sulfur patients, they are charming others. Their attitude is like this. They will charm the others. They are the charming personalities. So they will charm the others. You can see this picture just by seeing such patient or such person, very neat, tidy, and try to charm the others. Actually, sulfur is not neat and tidy, but wants to show. This is charming others. This is another rubric, vanity. Anyone have any idea about this rubric? It is also given in synthesis and Kent also. Vanity. Like user rubric, I have told you, this is another very important rubric. I have used both the rubric, user also and vanity also. And easily we can identify those rubric. Patient will not tell you that I am user, doctor, I will take the advantage of your facilities. He will not say. Like that vanity. Vanity, we have heard this word.
Show off.
Show off, show off. Yes. Usually for celebrity.
अपने पे अभिमान.
Yes. Usually celebrity have the vanity van, vanity car. So unnecessary they want to show that I am having these, that, and all those. This is vanity. So vanity is another very important rubric. Vanity is another important rubric that he wants to show that I am so and so. As well as beside all those rubrics, what we have studied, there are a few combinations. If you get those combinations in your clinic, you can directly give sulfur, which I also observe. Intellectual and intelligent. Intellectual and intelligent combination if you get, that time that patient or that person is sulfur. So intellectual and intelligent combination if you get, he is sulfur. Philosophy and ability for gambling. If you get such combination, that is again another is sulfur. These all rubrics are in the repertory. What is gambling? How the gambling you will identify in the patient? Philosophy you can very easily identify in the patient that he will try to tell you that doctor, I feel this disease is very dangerous, and this is because of taking the alcohol. Liver may be affected by this, and there are certain enzymes which he will try to tell you all these things. This is all showy. So he will put all this philosophy on you. He feel that he is great than you. So delusion great he is, rubric in the sulfur. So he will put all this philosophy on you, first of all, and with that philosophy, he will tell you, doctor, actually, I tried Ayurvedic, allopathic, and so many medicine, but I think I must take homeopathy also. I have thought that why not to take homeopathy?
Yeah, there is one comment from Dr. Amit Kumar. Gambling, one chance I'm trying to get treated from you.
Well,
One chance I am trying to get treated from you.
oh, sure, sure, sure. That is the gambling only. That is gambling only. Correct. That he will tell you that as I was telling you, he will tell you that I have come to you just to try the homeopathy and I will see why not to give you a chance to you also. That is gambling. That is gambling. So such type of nature, when you see in the patient, such type of words, when he or she will use that, as somebody comment that I want to give you chance that you treat me. See how much he is great. He is telling doctor that I want to give you chance that whether homeopathy is working or not. Let us see. I have tried Ayurveda. I have tried allopathy. I have tried this, that. Why not to try homeopathy? So this is ability for gambling. He will gamble. He will gamble. Like playing cards are there and we'll play that. So he will play all those cards in front of you. So this is ability for gambling. So there is combination of philosophy and gambling. You can give the sulfur and you will get the result. Then hypocrisy plus pompous plus egotism. What is hypocrisy? Anyone? Hypocrisy?
Those who are holding old custom and their
Okay.
fakeness exaggerated. That are the comments.
It is related to, it is somewhat near to
Biased.
it is somewhat to
Pakandi.
fakeness. They will so hypocritic that they will tell you, um, doctor, whether should I take this medicine? He will behave in this way. Should I take this medicine? Actually, he knows everything. He will come with all the bundle of information, but he will ask you only, should I take it? Should I do this? This type of fakeness. This is hypocrisy. Plus pompous. Pompous, when patient will come to you, he will tell you that I have two row houses and I am having Innova. Usually, I don't prefer to go by auto. My son-in-law is like this. This is pompous. This is pompous. And of course, plus egotism. So when such combination is there, directly you can give sulfur and you will get the result. So hypocrisy, pompous, egotism, such type of patient comes to you. This is sulfur. And egotism plus delusion wealth. Again, he is having a delusion wealth. Now, how you will identify that he is having delusion of wealth? Patient will not tell you that doctor, I am having delusion of wealth. How you will identify? Anyone having any idea? I will explain you. Don't worry. But how I have identified in my clinic. I have all these learns from one of my great teacher in Nasik, Dr. Namole. He is doing a mind method. I have learned all this from him. So thanks to him, thanks to Hanuman sir.
You'll
I'm
say
asking,
that I'm going to start something that I have business there, here. Likewise, from the talk.
yeah. From the talk, that is of course delusion wealth. He wants to show that I'm so wealthy. Actually, we don't know whether it is right or wrong or whatever, true or false. So but that is his delusion. This is not right. This may not be true. That is one way. Without saying. Usually in Maharashtra,
Then one comment is there. Only piles I have. disease and nothing more any disease.
Okay, okay. That is egotism. That is egotism. Delusion wealth usually see in Maharashtra, um, in village area, Maharashtrian family ladies are coming in clinic, Marathi family people especially, or those who are wearing very much jewelry. They come to your clinic by wearing jewelry and they want that somebody see it. So they will do like this. They will put the hand like this, having the all the rings and all those thumb rings. They will have these here in the helix and in the ear, all three, four earrings. They will do like this. Usually girls and females are doing like this. This is also a delusion wealth by gesture. And they will come with all three, four malas in their neck, one necklace, one big mala and all those. With all those, they will come to your clinic. Beside their talk, they will come with all that because they feel maybe that 1 gram jewelry, that maybe that we don't know, but they will come with all those. They will come with full of bangles, especially the golden. So that is delusion wealth because they feel, and they will put hand like this. How the male will come? Male will wear. I have that actually. I'm not sulphur, but this type of, I'll just show. This is golden watch. So they will come to clinic and they will put hand like this. This is delusion wealth. Golden color. Delusion wealth. Hope everyone is getting. Yes. So, and as already we have discussed, they will bolster the things. They will keep on bolstering the things about them. I have the farmhouse at so and so place. Doctor, why don't you come to my farmhouse? They will tell you like this because they feel they are great. So sulphur are like this. They are keep on bolstering. My son-in-law is working with minister. He will tell you like this. This is bolstering and pompous. Bolstering and pompous. Normally seen in the sulphur patient. And one very important rubric is flatter, desire to flatter. With all these, you can understand how the sulphur is. He will flattering you. Doctor, your skin is so nice. Doctor, your clinic ambience is very good. He wants to flatter you. This is flatter, desire to flatter. And he feels that you should also flatter with him. Such type of attitude is seen in sulphur patient. That is flatter, desire to flatter. And I think all those rubrics which I am telling right now are very easy to identify in the patient by his gestures, by the his or her talk. Once we understand and once we know that these are the rubrics present in the sulphur, then we don't need to find out burning in the sulphur is the keynote. I have not tell anywhere the burning, but burning and all those are the very common symptoms. We are not finding common symptom in the patient. We are finding PQRS and all these rubrics are PQRS which usually we see in the patient. So boaster, pompous, flatter, desire to flatter, and of course haughty. See, egotism, pompous, boaster, haughty, all these rubrics goes very near to each other, but there is thin line difference between all these rubrics, and one stage is ahead of that shade of emotion. So he is haughty also. If you say something to him, he feel that what the doctor is telling. Doctor, why you are telling like this? He will tell you in front of you only. That is haughtiness. That is haughty. Squandering. What is squandering? Anyone? Usually
Losing
sulfurs are squanders.
losing something, right?
No, no. Very, very expensive. He will spend the money unnecessarily. That is squandering. He wants everything grand. That is grandeur desire. Grandeur desire. He wants everything grand. Actually, he wants, but he may or may not be doing. That is sulfur.
Yeah,
Avarice,
spending.
And very important rubric in sulfur is bargaining. See, what we observe in the clinic, patient will come to you and if you say that my fees is 500, what he will tell to you, know, sir, please take 300 rupees. He will tell you like this. This is called as a bargain. He will bargain with you also. How you will come to know that? You will not ask him whether you are going in market for taking the vegetable, you are doing bargaining, then you will take rubric bargaining. No, it's not that. He will bargain with you only. If you say that my fees is 500 rupees, he will tell you, doctor, please take 300 rupees. How much charge you are taking? He will bargain with you. That is bargaining. And that is talking business of also. That is talking business of also. Len den, give and take. When patient will talk about anything about give and take, when patient will talk anything about give and take, that is called the talking business of. That is another very important rubric which I have seen in many of the cases of the sulfur, talking business of. And because of all these symptoms, what we have studied right now in all this PPT, he is unreliable. You cannot rely on him. Such a person who is not doctor and prescribing medicine to all the people and telling that you take paracetamol, you take camphor, you take, he will tell you that in COVID time, I have given arsenic to many people. He don't know whether to give 30, 200 or what. But he will tell you that I have given the arsenic to many people. This is what, this is pompous, this is egotism, this is delusion great he is. So he is unreliable because of all these things and deceitful, unreliable. You cannot rely on him because of all these things. So by this, you can identify the patient that he is sulfur. So all these symptoms which right now I have told you are about the sulfur. So I think just by beside all the keynotes, beside all the things, if you see these symptoms, these are the what we call as a sulfur. There are single remedy rubrics also, like weeping menopause at, weeping bathing in, weeping forenoon, then thinking mechanical, talking business of already we have taken. Those are single remedy rubric. Then shrieking, children will shriek, shrieking, then sadness, restlessness, perspiration, ameliorate. Reading desire to read, we have studied that. Reading desire to read medical books. He is having that habit to read the books. He is like an encyclopedia. He will tell you this thing, that thing, you know, half knowledge. He is having that half knowledge. That's why he feels that he is a ragged philosopher. We have studied that rubric and that symptom in the Allen's keynote also. He feels he is that a rag philosopher. Then politics occupied with politics too. He will keep on telling about the politics things and all those things to you. All, you know, I think sulfur is so common. Here and there you will find that the sulfur patient. Sulfur is very religious. Sulfur is very religious. He is having mania to be philosophical. Then uh, obstinate stool during, frighten easily, fear called by his name being, you know, this is again very good rubric that if somebody call him or her by his or her name, he will have that fear. Why people are calling me by my name? That fear, that kind of fear is there in the sulfur. So I think these all things are there in the sulfur. I have tried to cover those rubric only, those which are 3 mark in Kent, synthesis and complete repertory, and those which I have seen in my clinic, testified in my clinic. So I think that's all from my side. If anyone have any question, any query, uh, this time
Thank you,
I
sir.
have
It was
taken.
very wonderful. I was enjoying like watching movie, and even I am remembering many personalities. Many personalities come in front of my mind. That was wonderful.
Exactly, madam. Because you know, when we study rubrics in this way, or drugs or any remedy in this way, we will not forget the sulfur. But if you read in book, Boric or any book. Those books are very wonderful books. In college life, we have studied from that only. But if you study in this way, we will not forget the sulfur. And moment patient will come to your clinic, you will identify his sulfur. No need to take 1 hour history, 1 hour case history. Just by seeing the
Exactly.
patient, he is clinging like this, showing the watch, wearing this, sitting like this. All with these symptoms, you can say he or she is sulfur. I think Hariharan's sir is asking something. Sir, please.
Yeah. I will unmute him. I think nowadays these kind of people are increasing because of the Google, and they have many information from everywhere. Everyone is boasting in front of us.
Yes,
I
yes,
think
boasting,
everyone
pompous.
need. Yeah,
And
yeah,
that's why, madam, it has been said that sulfur is mother miasm medicine. Na? It's there with
yeah.
all, everyone.
Sir,
It's a
hello,
mother remedy.
hello,
Dr.
sir.
Hariharan sir,
Ha,
please.
sir. Ha, sir.
Sir, your narration regarding sulfur is very good, and the photographs are very good. See, one of my question is that why sulfur is called double-ended sword?
Why sulfur is?
Why sulfur is called double-ended sword? Sword,
Ha,
SWOR.
double-ended sword. I think, sir, because of all this is nature, that actually he is not having anything in him, but he feels that he is very great. Actually, the thing, substance is not there. He is having a half knowledge. He is reading just medical, he is not reading any medical books, and he is prescribing the medicine. This is one. This is one side of the double sword. Second, I think what I feel that at one point he is very mild, timid, what we have studied. And at one point he is very irritable, anxiety, anxious. He feels that he will become the insane. So these two shades of emotions. That's why I think he may be double sword. It has been said. I don't know in which book it is written, but because of this, maybe he is a double sword. That at one point he is very timid, but at one point he is very egoistic. So double sword.
Sir, okay. See, my assumption is not that because by application of sulfur, we must be very cautious while giving the sulfur medicine. Sometimes it may do so much harm to the patient, or sometimes it will cure the patient.
Ha, ha, ha.
So while you are applying the potency of sulfur, we must be very cautious. Otherwise, it will do harm or good. That is my assumption. Sir, your assumption is also correct. That I am appreciating.
Thank you, sir.
This is my observation.
Yes, yes, sir. Absolutely right, sir.
Okay. Thank you, sir.
Thank you, sir.
Dr.
Thank you.
Danesh. Dr. Danesh.
Yes, sir. Good evening, sir.
Good evening, sir. It's really a very good session indeed. And you have
Thank you, sir.
demonstrated how one can find the medicine in the shortest possible time by watching at the expression of the patient in different
Yes.
situations. But we all know that people may react even for an instant in quite different mode. But the personality of a person is always the same. So from looking at the personality, one can find the right medicine. And once you look at the case, you can find, you can go ahead with the medicine, whether it is a case of peptic ulcer, it's a case of piles, it's a case of mental trauma, or whatever be, or a rheumatism. The homeopathy prescription will be the same. That is
When we go with these methods, sir, it become easy for us to identify the remedy or the drug. We don't need to have 1 hour history taking. When we go and when we understand any remedy with the rubrics in this way, then it become easy for us because we have to see too many patients. If we keep on taking the history and neglecting the gestures and attitude, then it become very difficult. That's why I think to understand rubric in this way is the easy way to understand the medicine or the remedy.
Yes, exactly. The first one need to understand how what is written about sulfur in Mathematics. As we used to say that sulfur is a rag philosopher. So people may believe what is the meaning of that typical rag philosopher. Exactly, we can see lot of people in the wayside standing in that particular picture itself. So we can easily choose the remedy from the very outlook, and we can prescribe the remedy. That's the beauty of homeopathy, because usually people like you can make such things better for the future of homeopathy. Definitely, we need some presentations like this in the coming editions as per your convenience later,
Yes,
sir.
sir.
Thank
I
you.
think Dr. Manoj sir is also asking something.
Yes, yes, yes.
Sir?
Yes, Dr. Manoj.
Yes, I would like to mention about 2 points. One is the case taking, where Hനുman exactly mentioned when he completed the sketching. The word he used is sketched. The picture of the patient is sketched, not the portraiting. Therefore, it's not done for. Then again, he mentioned about this double-edged sword. As rightly mentioned by Hariharan sir, there is a strongly acting medicine, so caution is needed. They always aggravate. You can see a case in Kent.
Very
His
true.
philosophy describes one patient shouting on him, "You young rascal, again gave me that medicine." That's the
But sir, so many cases I have treated with sulfur. I have not
so
got,
unfortunately network problems. Pardon?
sir, please.
Network problem is there, sir. That's why I cannot continue, sir. Yes, please.
I have not seen any of the aggravation with sulfur patient with sulfur medicine with any of the patient. I don't know, but I have not seen.
One thing we must remember: whenever you administer a medicine or remedy or rather a drug, we may not get aggravations. But once you administer a remedy, definitely that will aggravate. Otherwise, there is homeopathy. It's not viable. Then the medicine, the attenuation, the potency, these are the selection of all depends on selection. And again, the ability of the physician to observe. You know, Hahnemann observed all these things, 100 medicines, 99 medicines he proved. How many medicines we proved? Even a single medicine. That's the difference between here. So we are just these followers. So our aim is to just to follow the masters, not the question.
100%, 100%. Okay.
Yes.
Yes.
Madam wants to say something.
No, Dr. Ram Parvesha, he was raising.
Yes, yes.
Thank
Yes,
you,
sir.
Dr. Anjani, and congratulations, Dr. Mukesh.
Thank you,
Very
sir.
nice presentation, excellent session.
Thank
Sulfur,
you,
sulfur, Dr. Senior Physician, Dr. Hariharan, sir. Sulfur is a double source. Very good. Sulfur, patient is philosopher and mentality. Always tendency mentality. Internal, emotional. Negative and positive. Both. Sulfur is a very good remedy. Chronic diseases, all chronic diseases, select the high potency sulfur one dose. Then clear picture of symptom, suppression if you see. So very, very thanks, Dr. Mukesh ji.
Thank you,
Thank
sir.
you, sulfur rubrics. Very
Thank you, sir.
select,
Thank you, sir.
subjective and objective. Thank you, sir.
Thank you, sir. Thank you, Hariharan sir. Thank you, Manoj sir, for asking questions and giving your opinion also. Thank you, and Ram Pravesh Shah sir. Thank you, Danish sir, and thank you,
Very,
madam.
very kind.
Yes, thank you. Thank you, Sahani sir also.
Dr. Rajini, there is an announcement for tomorrow.
Okay.
That is, tomorrow we will have a session from Dr. Vaibhav Jain, and he will be talking about a beautiful aspect of in a different style. That is agro-homeopathy, and that is something great. Nobody recently presented such papers here, but today Tomorrow, Dr. Vaibhav Jain will be talking about agro-homeopathy.
Okay, thank you, Dr. Mukesh.
Thank you, madam.
It was wonderful presentation. Actually, we are eagerly waiting for your next remedy with with this kind of rubrics, which
Sure.
picture rubric and explanation. It was an interactive session also. It was wonderful, and what you have taken, it's in our mind. So
Thank you.
really thankful to the session. Thank you.
But,
Now we have another.
other session medicine like the podium rubric.
So thank you so much. Come again, and thank you for everyone. We are moving to the Malayalam session, and I am inviting Dr. Mariamma John for conducting Malayalam session. Thank you so much. Good night, everyone. See you tomorrow at the same time.
Good night.